Pratima came to us. She was 34 years old, and she was suffering from drug-refractory epilepsy. She was having almost daily seizures, many of them leading to falls and injuries. This is almost since the age of 4 or 5, since childhood. Cause was that she had some kind of remote hypoxic hypoglycemic insult, following which she had developed bilateral parieto-occipital gliosis, that is scarring in the brain. Very common in India, especially in children who develop hypoglycemia when just after they're born. So because of this, she was having daily seizures, and it was really affecting her day-to-day life, and it was also affecting the family quite a bit. When she came to us, we did a pre-surgical evaluation because she was already on 6-7 medications when she came to us, which is not really optimal, because more than beyond 3 medications, the 4th medication doesn't really add much of a benefit in a patient, and when they are appropriately used, there's no point in adding any extra medications because they don't have, or they have marginal effect in some patients. So she underwent pre-surgical evaluation where we did a re-imaging. We recorded her seizures, and we found that there was multiple foci of seizures. She was deemed not a good candidate for resective surgery. Resecting one part of the brain where the seizures were, some of them were originating from, would possibly not translate into good seizure freedom in the long term. So her medications were adjusted very, very well to them. Her seizures were reduced by 90 to 95%. Her cognition improved because of the seizure reduction. Her EEG also improved, the background improved, and she was becoming more and more docile. She was able to follow conversations. She was sitting in one place. Previously, the mother used to have a lot of difficulties in managing her. Apart from the seizures, she would be very difficult to be handled in the hospital. She would not listen to the parents. She would be very stubborn. There was a lot of behavioral changes, which makes the biggest difference to the caregivers in these kind of situations. Following this, she did have a few focal seizures which were still persistent, but they were not leading to any falls, and they had reduced substantially in the duration and severity. So for these, the family was also counselled that there's another option of vagal nerve stimulation device implantation, and they were willing for said surgery. And after the implantation, she was discharged without any issues. And on follow-up today, we have done the programming, and we look forward to see how she responds to these, and these focal seizures also, which are somewhat coming through, breaking through intermittently. Will they also respond very well? Overall, vagal nerve stimulation is a palliative surgery. It is not the primary modality that we would like to give to a patient who has drug-refractory epilepsy, but in certain cases where they are not acceptable, or they're not deemed fit for resective surgery, this kind of implantation has shown to have some moderate benefit in seizure reduction, and indirectly by reducing seizures has also been shown to improve the cognition of children and their behaviour also. Right now, off-label is also been approved. Actually, it has been approved by FDA for even depression. So vagal nerve stimulation is a tried and tested modality that we are now also doing at care hospitals. Thank you.